Good morning, my people. Welcome back to my YouTube channel again, whereby today we'll be discussing about risk factors to diabetic nephropathy. And before we dive in, if you are there and you are watching this channel for the first time, please take a second or two, subscribe, and don't forget to put the notification bell on so that whenever I produce a video like this, YouTube will automatically notify you and you will never miss any of our educational bangers. For those who have subscribed, I always appreciate you people, for the returning subscribers, because this channel and the growth of this channel entirely depends on you people. So let's continue sharing with our brothers and sisters so that they may continue subscribing and supporting this channel as one big family. And I also appreciate those who are commenting on my job. There are those who are benefiting from this education, and I do appreciate you people, and I'll never tire educating you people as long as we are alive. So let's support this channel so that it may grow to greater heights. So, risk factors to diabetic nephropathy. We have just discussed in our previous video what diabetic nephropathy is and what it entails. So, risk factors or predisposing factors or factors that can lead somebody to getting diabetic nephropathy. And we are saying early diagnosis of kidney disease is essential or is important for preserving good health. Kidney is one of the most important organs in our body because it filters unwanted toxins from the body. So once the kidney fails, it's dangerous to the body because the toxins are dangerous to the systems, especially the heart. For example, urea and creatinine are one of the most dangerous toxins when left in the circulation. So, early diagnosis of kidney disease is essential or it's very important for preserving good health, especially for the kidneys. And when the kidneys are healthy, definitely the owner is also healthy. If you have prediabetes, type 2 diabetes, or other non-diabetes risk factors, your kidneys are already overworked and their function should be tested each year. This is very important. Early diagnosis of kidney disease is essential for preserving good health. If you have prediabetes, type 2 diabetes, or other non-diabetes risk factors, your kidneys are already overworked and their function should be tested each year. This is what we call kidney function tests. So if you have any kind of diabetes, whichever type of diabetes, make sure that your kidney function is tested each and every year, even without any complaints. Other risk factors for kidney disease include the following, or other predisposing factors, or factors that can lead to kidney disease include the following. Number one, high blood pressure, and we have been talking about this time and again. Number two, high glucose in blood or diabetes. Number three, we have obesity. Number four, we have high cholesterol levels. Number five, family history of kidney disease. If you have in your family there is a positive history of kidney disease. Number six, we have family history of heart disease. Number seven, we have cigarette smoking. Number eight, we have advanced age. Let me repeat this again. Other risk factors for kidney disease include the following: high blood pressure or hypertension, high glucose levels in blood or diabetes. We have obesity. Number 4, high cholesterol levels. Number 5, we have family history of kidney disease. Number 6, we have family history of heart disease. Number 8, we have cigarette smoking. And number 8, we have advanced age. So if you are there watching this video and you are a smoker, you should start quitting. You should start quitting this smoking thing. A point to note, which is very important, some populations, this is very important, some population, for example, African Americans, American Indians, Mexican Americans have a high risk of diabetic kidney disease. Let me repeat this again. Some populations, for example, African Americans, American Indians, Mexican Americans have a high risk of diabetic kidney disease. Genetics may contribute to your risk of diabetic kidney disease. Genetics means that you might inherit it or inherit the genes from your parents. You might find if your mother or your dad has this diabetic kidney disease, the genes might be transferred from the mother or from the father or from any of the parents to the kid. That's why we are talking about genetics. Causes of diabetic nephropathy. What are the causes of diabetic nephropathy? What causes diabetic nephropathy? Kidney disease doesn't have just one specific cause. This is very important. So it means kidney disease has so many causes. Kidney disease does not have just one specific cause. Experts believe its development is likely associated with years of unregulated blood glucose. And this is very important. If you have unregulated, uncontrolled blood glucose, it might predispose you to diabetic nephropathy. So, kidney disease does not have just one specific cause, but experts believe its development is likely associated with years of unregulated blood glucose. So, for those who always avoid taking anti-diabetic medicine, hypertension medicine, claiming that if you get used to them, what will happen? You will never live without them. So we have so many myths and misconceptions in our societies which are not helping us at any given moment. So if you are diagnosed with diabetes and the doctor advises you to use certain medication, the better for you. You should listen to your healthcare provider and follow what he or she is advising. Other factors such as genetic predisposition play important roles as well, or play important roles in the cause of diabetic nephropathy. Over time, having high blood glucose can damage the blood vessels in your kidneys. Other factors such as genetic predisposition play important roles as well. But over time, having high blood glucose can damage the blood vessels in your kidneys. This is very important. Then we say this. damaged blood vessels may work less effectively. So if the blood vessels are damaged, they won't be in a position to work the same way they were working when they were not damaged. That's why we are saying damaged blood vessels may work less effectively. Definitely, as the name suggests, they are already damaged. That means their work is compromised, and they won't work the same way they should work in usual circumstances. Damaged blood vessels may work less effectively. Next point. High blood pressure can also contribute to diabetic kidney damage. So it's always good to regulate your blood pressure. High blood pressure can also contribute to diabetic kidney damage. According to National Institute of Diabetes and Digestive and Kidney Diseases, many people who have diabetes may also develop high blood pressure. This is very important. Let's not assume anything in our body is usual, is the right thing to be there. High blood pressure can also contribute to diabetic kidney disease damage. And according to National Institute of Diabetes and Digestive and Kidney Diseases, many people who have diabetes may also develop high blood pressure. And this is very true. Even in our society, in our localities, when you find somebody is having high blood pressure, chances of being diabetic are very high. Or if you are diabetic, chances of you becoming hypertensive also are very high. This marks the end of our discussion today. And for those who have not subscribed, I'm still waiting for your subscriptions. Subscribe, like, share and comment our videos so that they may reach as many people as possible. And for the returning subscribers, feel appreciated because your support is pushing this channel ahead. For those who have given their topics and they have not been discussed, don't insult. Just be patient enough, because as I said before, these videos are not easy to make. So I have to take time and sit down, analyze, and come up with something which will be important to you, especially those who request specific topics. So if your topic has not yet been discussed, don't panic. Just be patient with me, and in due time it will be discussed, and I promise you that. Let's have a wonderful day ahead.